You're listening to Health Professional Radio. My name is Wayne Bucklar and my guest today is Emma Howard. Emma is the founder of Equilibrium and joins us from the Gold Coast in Australia. Emma, welcome to Health Professional Radio.
Thank you for having me, Wayne. Pleasure.
Now, I should say it's Equilibrium Health, I think, isn't it?
Yes, it is. Equilibrium Health Psychology Practice. We're a private practice with a team of almost a dozen psychologists.
And you get to enjoy the best part of Queensland in the southeast corner there.
Definitely, and we're only metres away from the glorious Broadwater.
Now, Emma, we've chatted with you on the program before. Today we want to talk a little bit about child psychology. Tell us what's been occupying your mind.
Wow, where do I start? Wayne, we've got a whole plethora of different child presentations that are making their way through the practice doors these days more so than ever. And primarily what I'm seeing with the professional development that I'm providing to the psychologists, as well as my interaction with families in a family systemic approach, is to see that behaviour-based interventions for children at an age of early intervention are not happening as readily as what they could for a family.
Mm-hmm.
So in simple speak, parents are maybe not equipped with the correct skills and tools to be able to bring the best out in their child, to lead that child to live a happy and healthy adult life.
Now, I'm kind of dealing from a position of ignorance here because I've never had the issue myself, but I'm assuming it's quite a challenging thought for parents to go, I think my child has a mental health problem, I need professional help.
Definitely. And it's also enabling that parent to say that, or see that it's not directly their fault.
Yes.
And that the process is about finding solutions and not placing blame. So sometimes it's quite a complex and tiered approach, namely the child might have the referral or the youth might have the referral. However, we as a team here at Equilibrium Health eventually, in a lot of cases, end up working with the family and the parents individually.
Now, Emma, am I correct in assuming that sometimes you're working with not quite newborns, but very young children around the idea of breastfeeding and attachment and controlled crying?
Definitely, absolutely. And so we call it perinatal. So it's around the time that a family are going to identify that they're going to bring a newborn into the world.
Mm-hmm.
And so we're discussing with the parent or parents the options that are available. And so at best practice, we're highlighting the pros and cons. I heard you say some very controversial approaches to parenting, and whether it happens to be the triple antigen injection
mm-hmm.
or controlled crying, to breastfeed, to not breastfeed. They're quite controversial because they're very personal options or choices that a family will make with regards to their newborn. So as psychologists, we are providing psychoeducation in a lot of times and saying these are the benefits and these are the costs involved with this type of approach to a parenting intervention or option.
Now, Emma, as we talked about before, a lot of our audience are clinicians of one kind or another, and most of them are either in acute care, doctors, nurses, allied health professionals, and we get a lot of people in aged care listening. So I guess today, with a view to the acute care people, what's the message you'd like them to get as a result of having heard you on the radio today?
That there is an option available for individuals with a mental health condition to be able to access a psychologist in private practice that is bulk billed under
mm-hmm.
the Medicare scheme, the MHCP or the Mental Health Care Plans, which is a better access initiative, as an adjunct or as a pathway or as a triage, so to speak, from a person that may be accessing acute care services. And so as we see our therapeutic approach here at Equilibrium Health, we work collaboratively with other allied health practitioners and also see ourselves as sometimes a transitional process, therapeutic process for an individual, whether it be they graduate from our service, so to speak, to be monitored and have top-up sessions and
mm-hmm.
become what we refer to as the worried well, or alternatively, we are making that referral for them to attend acute care and more specialised pharmacological intervention. So for anyone listening that works as a health professional, I think that we implore and espouse the collaborative approach with other health practitioners and see that we don't sit in isolation and don't see ourselves as an isolated approach for a person's wellness.
Now, Emma, I notice on your website that I've been having a look at, and by the way, listeners, that's www.equilibriumhealthgc.com.au. So all one word, equilibriumhealthgc.com.au. And I've been noticing on there, Emma, a big list of conditions and mental health issues that the practice gets involved in. I'm kind of seeing it as the complete list. I don't think there's anything particular that's missing to my mind. So you extend that across the age range to children and teenagers and adults?
Absolutely, and also to what is that kind of substrate of couples therapy, and then also family systems or family systemic therapy. And we're fortunate to be able to have a diversified team of psychologists that come from various special interest areas and areas of specialisation, so that if it happens to be that a patient lands or arrives to be given initial treatment by one psychologist in the team, what we like to do is ensure that that is the right psychologist, so they're not actually having to transition. But if that transition does occur, we work collaboratively as a team at Equilibrium Health so that a case conceptualisation and peer review is given of that person's presentation so that they can then be internally transferred inside the practice for ongoing treatment. And then, as I was mentioning, Wayne, earlier, that we work collaboratively with other health practitioners, namely paediatricians, psychiatrists, and the like.
Right. Now, I understand that if people do want to access that mental health care plan process where there is no out-of-pocket expenses, that does require a referral from a GP.
Correct, Wayne. So the GP provides the gateway or gatekeeper to the mental health care plan, and so a person who is interested in accessing sessions with a psychologist would then go and talk to their GP about the difficulties they're facing mentally. They may be talking about symptomatology or the symptoms, and they would be distracted from the dialogue in consultation with the GP. The GP may administer a psychometric such as a K10, which is a stress questionnaire, or alternatively a DAS, which is a measurement of D for depression, A for anxiety, and S for stress. So a measurement essentially of those common symptoms that a person would experience when they're having some mental health difficulties. And so meeting the criteria from the GP's identification, then the GP may write a referral for an initial 6 sessions and then subsequently a review of 4 sessions totaling 10 sessions per calendar year, should that person be eligible for that maximum number of consultations under the Medicare scheme.
Well, it's good to know that people need not suffer financial hardship in order to seek mental health care.
Definitely. We fully bulk bill patients or clients, individuals accessing our services, and we find that taking down that barrier or that roadblock or the hurdle of financial stress with how am I going to find this money to be able to get myself well actually creates another layer of stress again. So we remove that, bulk bill the service, provide a quality service, and hence the reason why we have such a commonly known name here on the Gold Coast, which is fortunate because the psychs really are energised by seeing their caseload full and people happy and getting the benefits of their years of training.
Emma Howard of Equilibrium Health in the Gold Coast, what's the best way for people to get in touch with you?
We have a communication portal on our website, which you mentioned earlier, Wayne, which is all the www.equilibriumhealthgc.com.au, and on Contact Us tab on the website there is a portal for you to just simply make an inquiry on the email. Alternatively, we have our practice landline 0755 28 22 55, and we've got a mobile that's manned pretty much 24/7, with the exception of a couple of wee hours of the morning, and that does go through to a message bank as well, and that is 0434 493 307.
So plenty of ways to get in touch with you there, Emma. Thank you for your time this morning. I do appreciate it.
Most welcome, Wayne. Thank you for having me.
I've been in conversation with Emma Howard, the founder of Equilibrium Health on the Gold Coast in Queensland, Australia. If you've missed my conversation, the good news is we have a transcript on our website at www.hpr.fm, and also on the website you can find links to an audio archive of the interview on both YouTube and SoundCloud. Thank you for listening to Health Professional Radio. My name is Wayne Bucklar.